And I am back to contrast and compare the conservative and liberal policies, this time in the sector of healthcare. So there are 5 main points that the liberals have proposed as part of their healthcare policies that they would enact. First off is exclusively a public healthcare system, completely opposing private practice. Second of all would be bilateral healthcare agreements with provinces and territories, which they have already enacted within some cases, such as BC and Ontario, I believe. Third would be addressing surgical backlogs and wait times, especially that were increased from the pandemic when everyone went through shutdown. Fourth would be expanding access to primary care, and fifth would be safeguarding sexual and reproductive rights. So I'm going to try and just cut through the jargon and figure out what all these buzzwords actually mean. So starting with the bilateral healthcare, basically they would provide funding to specific medical care initiatives depending on what each province prioritizes and what they need. So they would just allocate funding specifically for those different issues depending on each province and territory. These next two kind of make me chuckle a little bit. So addressing the surgical backlogs and wait times, apparently through funding. I don't see how that and capping wait times is actually going to help if there aren't enough professionals to fulfill the workload. Same with their expanding access to primary care. This would be through increasing access to virtual health services. If there's not enough bodies to do the work, I don't know how money is going to fix that, but I'll just leave that there. The other spicy topic is the sexual and reproductive rights. So saying that they're going to safeguard them, I think it's honestly playing to the theater a bit, because the reality is these rights are already protected, and they're protected throughout various areas of the Charter of Rights that we have, starting in Section 7, which is the right to life, liberty, and security of the person. So the courts have interpreted this to protect an individual's autonomy in making decisions about their own body, including reproductive decisions. Another area where these rights are safeguarded is in Section 15, which is the equality rights and protects individuals from discrimination, including discrimination based on sex, gender orientation, sexual orientation, which also includes access to reproductive healthcare services. So whatever narrative exists and that I've seen throwing around, Poilievre is not going to be repealing any of these rights for Canadians. His concerns revolve around gender care for minors, which again is enough content for an entirely separate video. And yes, while his personal, and I want to emphasize personal beliefs are pro-life, he has stated that he understands and respects the right to abortions and would not be taking this away. So I just really want to emphasize that, as well as someone who is pro-choice, he is not going to be taking away abortions. Coming back to the public healthcare only system, this topic is a bit of a headache for me, and there are several deep flaws that I find with the narrative that the Liberals are projecting. Firstly, they're presenting a false dichotomy of, if we don't have a public-only healthcare system, then that means we will have the same healthcare system model as the US. And my question is, says who? Like, why would we not look at other successful healthcare systems from our European allies? Like, why do we have to look only at the US? In terms of our European allies and their healthcare systems, I think an excellent model to look at is in Sweden. So they operate on a 2-tier system, the first being public and the second being private. They have publicly funded public hospitals, publicly funded private run hospitals, and privately funded and privately run hospitals. So most of the system's funding is provided through regional and local governments, and access to healthcare is based on need, not ability to pay, similar to us, and primary care is their first point of contact so that referrals can be efficiently streamlined. Now, even in the private sector in Sweden, the out-of-pocket costs that a patient may have to pay is capped through a high-cost protection scheme, which limits the total amount that a person is allowed to pay for healthcare per year. The benefit of a primarily public and privately supported healthcare system means that Swedish citizens have reduced wait times to access necessary care. So through the universal healthcare, if the wait times to see a specialist there in the publicly funded, publicly run sector is more than 90 days, citizens can elect to see a private specialist of their choice that the government will pay for. Contrasting that to Canada, if you have to wait more than 90 days, which is typical, I personally had to wait 7 months to see an immunologist, and you want to seek private care, only for elective procedures. I honestly don't know how to elaborate or explain that one because I'm genuinely still trying to wrap my own mind around that. But if you want to see a specialist for private care for necessary medical reasons, you're going to have to either wait for months on end to see someone in your province, or you can get on a plane or a train and go to a different province. I don't know. Having an exclusively public healthcare system has a devastating effect on everyone. Healthcare providers aren't able to provide adequate care because of the extreme overscheduling and leaving due to stress and burnout, leaving to find work in other countries where they have higher compensation. Patients are left waiting for often life-depending care for unacceptable amounts of time, and they have limited options. Emergency rooms are full to the brim and sometimes are even closed overnight. What I found really odd was to find out that about 2,000 nurses from Windsor, Ontario actually commute to Detroit, Michigan to work in private hospitals there on a daily basis because they're appreciated more financially than in Canada. Why are we not keeping Canadian healthcare workers in Canada by providing them more opportunities and easing the burden on public hospitals? As someone with chronic health conditions that I need to have regularly monitored, not having a family physician is one of my worst nightmares, and it's now also my reality. Let's switch gears and talk about the Conservatives. So while they still plan to operate under a single-payer system, they plan on extending the partnerships with non-governmental clinics so that they can, reduce wait times and out-of-province care that's needed, so that can be minimized. They also want to enforce a Safe Hospitals Act so that they can ban dangerous weapons and drugs from being permitted in hospitals. That way we can get a handle on the violence against medical staff that is pervasive right now, especially in British Columbia. And then the third policy would be the Blue Seal National Professional Training Standard, which would expedite licensing for qualifying professionals like doctors and nurses to, again, mitigate the waiting time for patients. And it would also allow these medical professionals to work in any participating province or territory without the bureaucratic nightmare. All right, coming down to my thoughts. While I would advocate for a multi-tiered healthcare system like the one in Sweden, I also understand that our current model of healthcare has been in place for over 50 years, and it would be extremely difficult to reconstruct the entire model. With that being said, I think Poilievre acknowledges this in his proposition by having the care being able to be executed by more than just government clinics and involving the private sector in some capacity for the benefit of those who require medical attention. I anticipate that one of the largest critiques he'll receive is the cost, as the plan is to spend $900 million in the 2025-26 fiscal year and a further $500 million the following year. But I also think that the transformation of a broken system into an effective and efficient essential service is worth investing in and will pay off in future years as we see the strain taken off of our healthcare workers and improved quality of care for everyone as a result. So stay tuned until the next episode where I will talk about the environmental policies and we can have a debate about that as well.